Ya Ali Madad. My name is Dr. Sana Somani, and I am so excited to talk about stroke with you all in this month of May, which is also Stroke Awareness Month. I would like to start by mentioning a few fun facts about our brain, which works as a tireless powerhouse managing everything from basic functions to complex thoughts, all while using very minimal energy. You'd be fascinated to know there are as many neurons in the brain as there are stars in the Milky Way, around 100 billion. Every second, billions of neurons fire tirelessly. It can produce enough electricity to power a light bulb, even. And in the 21st century, when every other body organ can be replaced, the brain remains the only irreplaceable organ in the human body. So, starting with what is a stroke? Most people understand what heart attacks are, so I will try to make a correlation with that. When we talk about a heart attack, we are saying that one of the vessels or arteries that supplies the heart is blocked off due to a clot. Similarly, when a stroke happens, one of the vessels in the brain that brings oxygen and blood to the area gets disrupted. This then causes that area to not receive the nutrients to function, and the brain loses control over that area, making us have a stroke. Every year, around 800,000 people have a stroke in the US. Strokes are of two types. The vessel can either be blocked off due to a clot or due to cholesterol deposits which grow over time, or the vessel can become weak and rupture, causing bleeding into the brain. Both of these result in permanent brain damage, so it is very important to seek care soon. This slide may seem scary with the statistics, but it is very, very important to realize how common this is. Stroke is the 5th cause of death and number 1 cause of disability in the US. Approximately every 40 seconds, someone has a stroke in the US. The best thing in this is that 80% of the strokes can be prevented. With heart attacks, losing heart muscle because of the clot makes most people have pain, and hence they are able to rush to the hospital in time. However, with stroke, the brain does not have any pain. It loses its function, and that is why many people tend to disregard these symptoms and think it is from being tired. So how do you diagnose a stroke? Remember this mnemonic: be fast. If you have any of these symptoms, or if you suspect a stroke in anyone around you, these are the things you need to remember. B stands for balance. You wake up and can hardly walk because you feel off balance or dizzy. That's concerning. E is for eyes. You notice that a portion of your vision is missing. This is more evident when you are driving and miss your blind spot. F is for face. Ask the patient to smile. Do you see a crooked smile? Are they drooling from that side of the face? A is for arms. Ask them to raise both their arms up. Is it difficult for them to raise one of the arms? S is for speech. Ask them to say something. Are they slurring their words? Are they making sense when they are speaking? If you notice any of these symptoms, T is for time. You cannot lose time. You need to call 911 immediately. Don't sleep and think it would get better. Time is important and we cannot lose it. And why am I saying that? It's because time is brain. Every minute you don't seek help, that is 1.9 million neurons lost. The sooner you arrive to the hospital, the more chances we have to save your brain. If you arrive as quickly as 4.5 hours from your symptoms, you could potentially qualify for a clot-busting medication depending on what time you were last normal. And if they find a large clot in your brain, they could do a procedure to take that clot out. But as I mentioned, these treatments can only be offered within a certain time frame. So the earlier you come, the better. Coming to prevention, how do we do that? Get enough sleep. 7 to 8 hours are needed for all adults. Be socially active. Talk to your friends and family. Meet them regularly. Talk to them on the phone. Eat healthy. That means less sugar, less salt, less red meat, more water, more fruits, more vegetables, more nuts, more fiber. Exercise at least 150 minutes a week, which is 30 minutes for 5 days a week. This does not need to be intense. Walking is often underestimated. Park a bit far and walk to your destination. Take the stairs if you are able to. Make sure you are seeing your primary care regularly to check your blood pressure, cholesterol levels, and medications. Avoid harmful habits. Smoking and alcohol can raise your risk for stroke. These are small steps, but they make a huge difference. Some take-home points. There is no replacement of the brain. Stroke is when blood flow to the brain is disrupted. It is very common, number 1 cause of disability and number 5 cause of death in the US. Remember, be fast is the mnemonic. If you notice any of the symptoms, please call 911 immediately. If you present early to the hospital, we can treat you and save much of your brain from permanent damage. And most of the strokes can be prevented by basic lifestyle changes. Thank you and Yali Madad.